there.
Hello.
I'm Amanda. I'm going to be a nurse working with you today while you're here. Can you tell me your name and date of birth, please?
Peter Smith, 3/13/1986.
Perfect. So I understand you are here for your anal exam, and I'm going to be checking some areas around your head, your neck, your eyes, ears, nose, and throat. We're just going to check to make sure everything looks okay, give us some information about how you're doing, and if there's anything we need to be concerned about or be aware of. Does that sound okay?
Great.
Okay. So for the most part, I'm just going to be kind of inspecting you, but there are going to be some more, not invasive, but I am going to be getting a little bit more in depth on some of my assessments. So I'm going to be touching your head and your hair. I'm going to be palpating some areas on your face and your neck. I'm also going to be having, at one point, I'm going to have you open your mouth so I can look inside, just to see what your teeth and the back of your mouth and your palate look like. That's okay.
Cool.
Okay. Okay, so the first thing I'm going to ask is, do you have a history of any head, neck, or throat cancer in your family or yourself?
Yes.
Okay. Can you tell me more about that?
My dad died of esophageal cancer.
Okay. Do you have any personal history of any head, neck, or throat cancer yourself?
No.
Okay. Have you had any sort of injury or surgery or anything invasive to your head, neck, face area?
No.
Okay. Great. Is there any pain or any tenderness anywhere, your head, neck, face area that I should be aware of?
No.
Anything that you've noted, that you've seen, that you want me to look at a little bit more closely?
No.
Okay, great. Okay, so the first thing I'm going to do is just inspect your head. You can just sit there. I'm just going to look at it. It appears that it is centered and evenly aligned on your neck and shoulders. It's upright and straight. And it looks like, from what I can tell, your facial features are symmetrical and everything is evenly proportioned there. I'm just gonna look at the back. Great. Okay, can you smile for me? Great, big smile. Show me your teeth. Perfect. Okay, so you can stop smiling, thank you. It looks like your facial features are symmetrical when you do move. That's great. Now what I'm gonna do is just palpate your head area and down your face. If you can tell me if there's any tenderness or pain anywhere I'm touching, that would be really great. I'll stand up and do that. Normally I would wear gloves for these. Unfortunately, I don't have any gloves at home, but I will ask you all to wear gloves when we're doing this as part of your assessment. Okay, so I'm just kind of noting if I feel any lumps or bumps, or if I see any skin lesions or anything abnormal here. It looks like you do have a bald spot on the top of your head. Is that normal for you?
No.
Okay. Is this new?
Yes.
How new?
A year or so.
Okay. Did it occur drastically, or has this been kind of a slow?
No, it's been kind of a slow crash.
Okay. Okay. Again, any pain or tenderness?
No.
When I'm touching any of these areas? Okay, great. Thank you. His skin was all intact. I didn't notice any lesions or open areas of skin. Okay, I'm gonna palpate or touch your jaw now. So the areas where your jaw meets the top of your head. Go ahead and open your mouth for me. Okay, go ahead and close it. There is a little bit of clicking on that right side. Do you feel that normally?
Yeah.
Okay. Is it painful at all?
No.
Okay. Have you ever had like it lock into place? Okay, cool. Close your eyes for me. So close, open. Perfect. Okay, great. You can open them again. So it looks like his lids are approximating. I don't notice any drainage from the eyes. It looks like the sclera may be a little bit red, but it seems like that's probably from being tired, not from any like broken blood vessels. So again, I'm going to ask you guys to please put on your gloves when you do go in in depth into inspecting the eyes. But now I'm just gonna kind of put my fingers right under your bottom eyelids and just gently lower your lids. I'm just gonna look at the skin underneath. Okay, so I'm just gonna gently lower it. It looks like they are pink and moist. And again, his sclera is white. I don't notice any broken blood vessels or any obvious pinkness anywhere. Okay, I'm gonna move on to your ears now. So first I'm just going to inspect them. I'm gonna touch them here as I'm doing that. Any pain or tenderness there?
No.
Okay. You don't notice any drainage or any buildup of a lot of wax or anything coming out of the ears. Okay, great. It seems like you've also been able to hear me okay? Is that
Yes.
correct? Okay. Have you noted any have you noticed any hearing loss or any issues with that? Okay, perfect. Have you been able to hear high pitched and low pitched okay as far as you know?
Yes.
Okay, great. Okay, I'm gonna move on to your nose now. So first I'm gonna look at it. It looks even, maybe slightly curved to the left side a little bit, but it's straight on in your face. And I don't notice any drainage coming out of that. Have you ever broken your nose? Oh, okay. When was that?
Maybe 7 years ago.
Okay. Did they have to do any
sort
of surgery or anything?
No surgery. They just
okay.
Stuck a butter knife in there and
popped it back into place.
Yes.
Okay, great. Have you had any like lasting difficulties breathing or anything because of that? Okay, great. Speaking of that, I'm gonna check how well you're able to breathe out of each nostril. So I'm just gonna pinch on one nostril to occlude it, and then I'll have you breathe out of the other one. So go ahead and breathe and out. Breathe in and out. Great. Seems like you're breathing okay there. Okay. Okay, let's move on to your mouth now. Your lips are pink. They might be a little dry, but sometimes this time of day. How much water have you drinking today?
3 32-ounce.
Oh, good for you. Okay, maybe just a little dry because of that. But I don't know any. I don't notice any cracks or any splits or any drainage or anything there. Your mouth is also symmetrical in your face. That's fine. Okay, now I'm just gonna have you open your mouth, and I'm just gonna look inside. Hold on a second. You guys will have access to tongue blades. I don't, so this is just the end of a butter knife here. But you are gonna need it to hold your partner's tongue down a little bit so you can look in the back of their throat for their tonsils and their uvula. Okay, so go ahead and open your mouth. Don't stick your tongue out, you can just leave your tongue where it is. I'm just looking to see your teeth here. Looks like your teeth are white. You have all of them, it looks like, except for your wisdom teeth, not there anymore. It looks like you have a dental implant device. How long have you had that?
In the front?
The lower, yeah, the front here.
I don't know. 20-ish.
Okay.
20.
Has it caused you any pain or irritation
No,
or
it's annoying to
problems?
floss around, but.
Okay. Okay, great. Okay, go ahead and open your mouth again. Sorry. I don't have a flashlight, but this is also something that would be good for you all to have if you are having difficulty seeing the back of his mouth. Can you open a little bit wider? Thank you. Okay, tongue is pink and moist. That's great. The upper palate looks pink and moist as well. Go ahead and raise your tongue to the top of your palate. Thank you. And the bottom palate looks pink and moist as well. Thanks. Okay, I'm gonna have you stick your tongue out for me. Just perfect, and you can bring it back. Now stick it out and move it from side to side. Great. Now I'm going to use this to kind of just hold your tongue down as I look at the back of your throat. So go ahead and say ah. Okay, so tonsils are not enlarged and his uvula is moving back there. We are not checking for the gag reflex in this particular class, but that could be another thing you could do if you suspect any sort of cranial nerve deficit. Okay, thank you. So 2 more things. First, I'm going to have you do some range of motion on your neck. I just want to check to see that your neck is moving smoothly and you're not having any pain or anything when we do that. So first, I'm going to have you do your chin to your chest. Great. Now you can bring it back up. Now go right ear to right shoulder, left ear to left shoulder, chin to right shoulder, chin to left shoulder, and then tilt all the way back so you can stare at the ceiling. Great. Come back up. Any pain or decreased range of motion while you're doing that anywhere? Okay. Okay, now the last thing I'm going to do is just quickly touch your face a little bit, and what I'm doing here is I'm just seeing if there's any enlarged lymph nodes anywhere. Okay. Let's start back here and just gently go down. I know it's probably hard for you guys to see, but this is just kind of a gentle rolling motion, and you can normally feel if there's any enlarged lymph nodes that way, especially these under the tonsils. They are usually big if someone is sick. I don't feel anything. Okay, great. Well, everything looks okay to me. Do you have any questions for me or any concerns?
No.
Okay. That was our assessment of his head, ears, eyes, nose, and throat.